Hey everybody, it's Trish at the Vista with Forsyth Plastic Surgery, and I'm here with Dr. George Lawson and his nurse Kayla.
Hello.
And we're going to talk about breast surgery today.
Thanks for joining us for our open house, which is virtual. We'll also have a live session if you want to join us at that time. So Kayla is here with me. We see a lot of patients almost on a daily basis for breast surgery, and that can range from options of, changing the way things look, different shapes. Some patients have reasons to have surgery like cancer or needing a breast reduction. So we do see patients of all ages, sizes, shapes, all that sort of thing.
Yes, absolutely. We see a lot of patients for mommy makeovers, which include doing a lift and maybe an augmentation at the same time. We see a lot of reduction patients, a lot of breast cancer patients. So we're here for anything you need.
A lot of patients that come to see me have questions about breast implants. There is a lot of information out there on the internet, but there's also things out there that may or may not lead you down the right path with the information that you need. So most folks that come to see us have done Google searches or looked online at things, and I think it is important to be educated before you come in, but we also have information that we can tell you about that's been scientifically tested, things that we know from the data and the studies out there for safety, and it's really a private discussion with the patient on the risks and benefits, but many patients do get benefits from breast implants.
Dr. Lawson, do y'all have before and after pictures that your patients can see?
Yes, we take privacy very seriously here. There are some photos that we can show before and after pictures that we've gotten permission from patients from. So if that is something that you're interested in, we can certainly show you that while you're in the office here. I like to encourage patients to try to find other patients of the same body type or age that they might be, so that we can have really reasonable expectations of what we're able to do. Not everyone is the same, and everyone needs something just a little bit different. So we'll try to tailor that to you when you come to see us in consultation.
So Dr. Lawson, I understand that some women are a little uncomfortable asking some questions. So how do y'all handle that?
Well, I think Kayla and I and my nurse Candace do a great job of making patients feel comfortable around us. We want to be honest. We want to give all the information that we have. So it's nice to meet face to face and go over the concerns and try to come up with a good, unique plan. We want this to be a rewarding and fun experience as well.
Dr. Lawson, we see a lot of patients for breast reductions and breast lifts, don't we?
We certainly do. Patients come to see us now because they're so active and they have, busy lifestyles. And one of the things that we're able to do is really give you that feeling back where you're able to be more mobile, you're able to move around comfortably, but there are a lot of benefits to doing a lift and reduction besides that. It can help with shoulder pain, back pain. Some folks have skin conditions or irritation that the breast can bother and make that worse. And really, a reduction or a lift is going to reset things and put it in a really good spot, make you smaller, more comfortable, while allowing us to leave you enough with fullness and cleavage that you can fill out your clothes great.
And we also say that our breast reduction patients are typically our happiest patients because it's a big lifestyle change that they get from the benefit of surgery and helps most of the time alleviate a lot of their discomfort too.
Okay, do y'all see mommies that come in and want a little structure after they've had their babies?
We do. We see young mothers come in all the time. And I think, one of the things that's very important is to see where you are as far as your journey with bearing children. It's nice to be at that point where you're finished having kids, because things that we do can obviously alter things, and you want to make sure that you're not going to be breastfeeding, that pregnancy can change the size and shape of your breast. So we want the timing to be right for you. But we see a lot of younger patients that come in after having children, and we go over all the options.
We also see a lot of patients in their 50s and 60s who are done with childbearing, who just kind of want to get everything reset back into a good spot so that they can enjoy their new bodies now.
Are y'all seeing patients that want a little bit more athletic, figure, not so big, but maybe a little bit more, normal size?
We do. Thank you for bringing that up. Most women that come to see us are active, they're busy in their life, and there is a trend to where patients want to have things to where there's not as much fullness or volume. And definitely there's some benefits to that, especially with a certain lifestyle. And those are all things that we can talk about when you come in. So thanks for bringing that up, Trish. But I would say that is a trend for patients that come to see us.
Okay, everybody, we've heard a lot about breast implants, breast reductions. So if you're interested, please give us a call.
And we're very knowledgeable about the options that are out there. And certainly Kayla's with me, so we're always trying to make our patients very comfortable.
We can't wait to see you guys come in and answer all